Helping the Undocumented Obtain Health Care in New Jersey, a Proposed Policy by Christopher Cogdell. So some quick facts to lay out. To obtain health care from the state of New Jersey as an immigrant, you've had to held legal residence for at least 5 years, be under the age of 18, or currently be pregnant. Now in New Jersey, between 2009 and 2012, it saw the biggest increase of immigration in all of the U.S. It had an increase of up to 16% of its population. Undocumented workers accounted for up to 6% of the total population in New Jersey. It is also estimated that immigrants paid close to $600 million to the state and local taxes. It is also estimated that immigrants cost up to $1 billion in Medicaid and emergency care. So how does this affect New Jersey? The cost of Medicaid outweighs the cost of paid state taxes, leaving residents to pick up all the extra. Without offering health care, this leaves many not getting proper preventative care or the chance to pay back some of that state and government by having a lower rated healthcare option. Many of these people cannot speak English or understand English when it comes to medical terminology, causing great delay in care. This creates longer waits at the hospital for those that need the care and have insurance, but now they're waiting on the uninsured and undocumented to be processed. Many immigrants come from countries of poverty and have never had a proper screening or vaccinations. This poses a threat to the current populations in New Jersey. So the proposed healthcare for immigrants. If we were to enact and add a healthcare option for those that have not met the 5-year legal status and are undocumented immigrants, we would have to allocate money to fund for preventative care and screenings, plus additional training for translations or hiring of a medical translation nursing system. This will affect the taxpayers because the money will need to come from the state funding, since federal government does not have a system in place to help this population. This policy will help document and create awareness from screenings of what typical illnesses, viruses, or chronic diseases immigrants are coming to the U.S. with. This will also help raise awareness of life-threatening diseases like AIDS, Ebola, and many more. This will change thousands of immigrants going to emergency care when it is too late and when it could have been noticed prior. Also, if we are to implement some type of translation service, this would allow immigrants to properly talk and understand the medical terminology and avoid having to even go into emergency services because they can get some of that information over the phone. The impact of this policy. This policy would implement screening care costs at the fraction of the cost to help obtain some of the money back and would be free from the threat of deportation. Because if that threat is there, then the system will not work. This will help current immigration strength in New Jersey and help keep the economy going as it is. 28% of New Jersey's workforce is immigrants, and the state would come to almost a complete standstill if we lost 28% of our workforce. If we are to enact this policy, we are not encouraging undocumented workers. We are alleviating how backed up the wait times are at the hospital. We are recognizing and documenting current healthcare threats to the community. We are recouping some of the money lost to emergency care. So if you're still not on board, some might think what we are proposing, we're just asking for more undocumented workers to come to our state because we will help support them. But we cannot have this type of perspective or mentality. We must see this as a way that we are helping the community from having to pay more to cover from the losses for uninsured. If you see someone working on a hot day, wouldn't you offer them a cold drink of water because they are a human being? If they are sick and ill, wouldn't you want them to have some way of offering towards paying to healthcare because they are a human being? Currently, New Jersey still has some of the highest increase of immigration rates. And if we continue sweeping the healthcare issue under the rug, we are going to have to climb up a hill when we could easily be walking across the floor. Since most costs come from emergency care, which only slaps a band-aid and sends them on their way, it does not include any long-term care. Then they have to come back into the emergency care system because this is the only place where they know to go to receive any kind of help. According to Cortez, low-skilled immigrant laborers is directly related for the cost of goods and also the revenue generated from exports compared to low-skilled native workers. So we're not encouraging them to come to our state, but we know they are a vital asset to the driving economy here.